So you were participating in an interesting debate on role of stress echo in evaluation of CAD patients. Sir, in what disease of heart or cardiac problems can stress echo have a diagnostic role?
Stress echo over the last 2 to 3 decades has evolved into a very robust technique for the evaluation of coronary artery disease and also valvular heart disease and also in some cases of heart failure. And it's an ultrasound based technique, so it is absolutely free of biohazards. You can repeat that as many times as you want. And it also gives a lot of information of the heart both at rest and at peak exercise.
And how this is superior to CT angiography, which is an upcoming technique in management of cardiac problems?
I don't say that it is superior to CT coronary angiogram, because CT coronary angiogram is obviously an anatomical imaging. So it is going to look at the coronary, so it is going to have a high sensitivity. What we are talking about is its practicality.
Correct.
The stress echocardiography works out to be the most cost effective and practical approach in the evaluation of patients with suspected coronary artery disease. And this is true not only because of its cost, not only because of its absence of biohazard, but the most important thing, it can be repeated multiple times. Whenever there is a change in the symptoms of the patient, you can repeat it. You cannot keep on doing the CT angios with every change in the symptom. So we don't say it's sensitive, but I think it's the most practical and cost effective approach.
So that means it could have a role in follow-up of patients as well?
Exactly. I think that role is most important, because a lot of patients with coronary obstructive disease may not have symptoms and may not have any exercise limitation. In these patients, they are being managed with statins, aspirins, ACE inhibitors, and they are being followed up for years together on conservative medical therapy. Now, in these patients, if there is sudden change in the symptom status, okay, like a new onset of intolerance of exercise or new onset of symptoms, you have to validate those symptoms and you have to find the progress of the disease. In such cases, you cannot keep on doing the anatomical imaging. The way to follow is by functional testing like stress echocardiography to follow up these patients.
Is it available freely in India currently?
Exactly. That is another contention against the CT angio. The CT angio is very expensive equipment. You cannot divulge your resources to such huge investments. We are fighting at the same time coronary epidemic and also the infectious disease. So you cannot reallocate your resources only to say a premium category investigations like CT, while stress echo is very easily available because the ultrasound machine and the proximity to a treadmill, that is the only thing that you need, and a room. Okay, it is available at every district taluka place that you will have an ultrasound machine, you are going to have a treadmill. So it can be done everywhere and every place, and most cost effective, and definitely has been shown to have an added value to to the basic stress ECG.
What will be your message to large number of physicians who are the primary point of contact for our patients? When should they refer these patients for this investigation?
Yeah, I think the among the large population, now the first thing is to look at the clinical risk scores, and there are lots of clinical risk scores are available, and find out whether they are fall into a high risk score or not. Okay. Second thing is those who have got symptoms which are suggestive of coronary artery disease. I think stress echo is very handy to validate the symptoms and also to diagnose a significant lesion. Then there will be a large pool of patients who already have been diagnosed as coronary disease, or they are post PCR, post CABG, and they are being managed medically well. Now, in these patient categories, if there is any change in the symptoms or new onset of symptom pattern, then the stress echocardiography again comes into the play, where you can validate the symptoms also, diagnose the progress of disease, and take appropriate measures.